So, good morning, everybody. And as of today, we have 2,750 positive cases of the coronavirus in Albany County, 620 people under mandatory quarantine, and uptick of 25 positive cases. Out of the 25, 23 have had close contact with people that were infected. Two don't have a clear source of infection at this time. So, it's one thing we're keeping track of as the uptick continues to go upwards and down. There's a lot of numbers that come into play with the control room, with state DOH, with our Department of Health. So there's a variety of things that we have to watch and continue to monitor. And just like the other day, we had 11, and today we got 25. 10,890 people have now completed quarantine. Out of those, 2,635 tested positive for the virus, increase of 27 recoveries. Some of the good news is that 7 people are hospitalized. Not that that's good news, but it's down from 15 people 2 weeks ago. We had multiple people in the ICU, and as of today, we have 0 people in the ICU for the last 2 days. So this is one thing that the control room continues to monitor, our hospitalization rate, not just here in the Capital District, but across the state. So this is all good stuff when that number stays low, and we hope to get it to 0 shortly. So with that, gives us a hospitalization rate of 0.25% of those that have tested positive, and the rate yesterday was 0.25%. Over the last 5 days, our average has been 19 new positive cases each day. Yesterday it was 19, or the week before it was 19.6. Again, we call on everyone, please wear a mask properly, as Dr. Whelan elegantly points out, and sneeze into your arm, cough into your arm, meaning your elbow. Clean your hands, and continue to stay 6 feet apart, and we'll get through this. Whether you have any signs or symptoms, please go and get checked, because the more people we know, we can tell how this virus is affecting us in these last couple of weeks. It has changed, a little bit from 6 months ago, what we were dealing with, until now, how it's affecting people. But again, it helps us with that age group of kids at 20 to 29, really up to 39, and we're more worried with people with underlying health issues and everything like that, to make sure that we're not spreading this. And it doesn't mean your world ends if you come back positive. You just got to self-quarantine for 14 days, and then you get to go back out. So help us continue to keep this under 1%, and continue to work with the governor moving forward to keep New York State one of the lowest infection rates right now, I believe, in the nation still, not unless that's changed, but the last I looked it was that. But you can get your appointments at state testing sites at University of Albany at 1-888-364-3065. Also our mobile testing sites with Whitney Young and the partnership with them, 518-465-4771, Rite Aid and Colony, and again, go on the riteaid.com website, and Walgreens on Holland Avenue. You got to go on the website, walgreens.com/findcare/COVID-19/testing, and you can get that done. And as always, our partner with Priority One in Gilderland, and please go out. Just because, again, if you get tested, it helps us. It helps the Department of Health. It helps Dr. Whelan and her team know where it's going, how it's affecting different areas of the county, and it helps us properly plan for things going forward. We're not trying to scare people. I don't know. I just keep seeing that constantly pop up on our Facebook, that we're trying to put fear into people. The only fear I'm trying to put into people: do the right thing. Wear your mask. Cough into your elbow, sneeze into your elbow, clean your hands consistently, and stay 6 feet apart. Other than that, continue to do the right thing. Most of the people in this county are in the Capital District, because our infection rate's so low. It's just that small population of people that feel that, oh, this is fake. I will assure you, it's not going away after November 3rd. We're not going to wake up the 4th of November and say, oh, wow, we either got a new president or we don't, and, oh, this no longer exists. It's not going to happen, people. And if you don't believe me, look at the businesses that are suffering around the county, the restaurants, the hotels, banquets, facilities, in the movie theaters. I mean, I know the government made a stance yesterday that they're not going to open up, and I feel they can do it in a proper way, in a safe way, but we're dealing with that too. So that all being said, Dr. Whelan.
Morning. So as the county executive indicated, we continue to monitor daily our cases and make sure that we follow up with appropriate case investigations on the day that we're notified so that we can trace contacts and ensure that we're doing the best that we can to control the spread of COVID in Albany County. I would echo his statement that if you are feeling symptomatic, it is appropriate to be tested so you know that you're doing your best. Even if your symptoms are mild, you always can run the risk of having a COVID infection and spreading it to someone who will be more seriously affected by that, and that is what we're really trying to control. We're continuing to work daily with the schools and getting a lot of questions from our K through 12 schools. We've provided them with guidance and algorithms and frequently asked questions, which we may continue to develop based on their feedback. Again, I want to thank all the superintendents, the principals, the heads of school for their partnership and their dedication to really ensuring that their students are in the safest possible environment. We also continue to work with our colleges and universities and monitor cases at SUNY. We're continuing to see a low number of cases on campus compared to the overall number of cases. And our relationship with them continues to be positive and productive. We speak to them on a daily basis. We are mutually committed to keeping the students at the university safe and to doing what we can do to control the ongoing spread. SUNY, as we have indicated in prior press conferences, has been a wonderful partner, and they continue to be a wonderful partner on a daily basis. Thanks.
Thank you, Dr. Whalen. And, again, I like to pick on her because she wears two hats as a mom, first and foremost, and, a parent having kids in college. So trust me, she's on top of that issue, as she is for all the schools here in Albany County. And listen, we have contingency plans, what we're going to need to go forward. But some of the other things that, we've been putting out there is the food insecurity really has become more widespread. As we've been shut down and through this health crisis and now dealing with the economic fallout of being shut down, it has a ripple effect. And if you look at our Department of Social Services, last August, we had 974 applicants for SNAP benefits. This August, we had 1,322, and that's up 348 from last year. It just compares the snapshot in time, from this year, from last August to the year before. But again, for the first week of September, which is alarming to us, we're roughly gotten 135 applications this time period last year. This year, 820 applicants, and it could be tied into now that the federal aid stopped, the extra $600. Some people will get the $300. It was a great question that was brought up by Amanda Fries from the TU when we were talking about this. This is the barometer for all counties across the state of New York, across this nation. It's one of the things I was talking about as president of County Executives of America to other county executives the other day, is that we're seeing such a huge uptick in this number. And it's scary because as we still slowly open up for obvious reasons and the governor's great leadership, this is going to affect us. And as jobs don't come back and more people get laid off, people are going to need more assistance in the county than they ever did before. But these numbers we haven't seen in my 8 years as county executive, my time in the legislature. These are huge numbers that we've never had before. Even with the recession of 08-09, we didn't see an uptick to this magnitude. So these are going to be issues that we need to address to go forward. But roughly talking about that on that aspect too, on Tuesday, as president also is NYSAC, New York State Association of Counties, with Steve Aquario and my counterparts, we sent a letter to the congressional delegates of New York to support the bipartisan framework for the state and local aid put forward by the Congressional Problem Solvers Caucus. It includes a framework of $500 million from the federal government. The funding needs to be flexible, unrestricted, and to ensure we can close the budget deficits that we've been created by the loss of sales tax revenue, and should be based on population. Just like the CARE Act, what happened was Erie County made out. about. Other, Long Island, Westchester, I could go on. Anyone with over a population of 500,000 residents got CARE Act money. Well, that helped with their Department of Health. And you look at the resources that our Department of Health has used, the positions and everything else. A lot of that's grant funded. There's a lot of overtime. So that CARE Act's money really offset all that stuff so they can continue to do the great mission. And it's one of the $1 million questions as we go forward, and the feds are cutting, the states are going to cut. It's a trickle-down effect to the counties. And as that continues to happen, well, how do you continue to do the great work? And you can't go over the cap, and you can't do different things. It makes it challenging, and it's challenging not just for me, but for every government across the state, all 63 counties, and across this great nation. And these are things we continue to talk about. We need a bipartisan approach with Republicans and Dems. We can't continue to let this president divide us amongst Democratic-run states versus Republican-run states. We're in this together. We're in this together, and we need leadership. And we need people to come together to give the relief that we need now, not tomorrow. We need it now. So we have been on the national level as well as the statewide level, everyone coming together saying the same message. Take care of us. Get us the money that we need. It was great that Rochester and Erie and the rest of them, all got taken care of with the CARE Act money. We didn't get a dime. And we need to get that money so we can continue doing the right stuff. So we're also calling on Congress to modify the $150 billion for state and local governments in the CARES Act, which I talked about because of the population of 50,000. We need everyone out there watching this, listening to this. Please reach out to all your delegates, reach out to Congress, reach out to your Senate and Assembly members, call on them to do the right thing because, over 70% of my budget's unfunded mandates, meaning that the state Senate and Assembly tell us what programs we have to run. They tell us we have to increase it. They tell us we have to do this, but they don't give us the funding. And as we go forward, if they continue to push stuff down on us, where do we go? Do we cut the great services that we provide to the people? Because people in this county need these services more than they've ever needed before in life. They need them now. And they're going to need it going into the future. And you can't just continue to roll downhill and say, okay, it's not my problem. You fix it. But you continue to run this program. But we're not going to fund you anymore. So I am calling on our senators and assembly members here in this great state of New York. Do your job. Roll up your sleeves. Figure out the schools. Figure out the problems going around the state of New York. But realize we have still a health crisis going on top of an economy crisis. Work with your departments of health in your respected areas of the New York State and give them the funding, but also give everyone else the funding. And, we'll get through this working together with great leadership. So, again, I want to thank the Governor Cuomo for his leadership and his team. And also to remind people that we have mental health support available 7 days a week from 8 a.m. to 5 p.m., 518-269-6634, and our 24-hour sexual assault hotline number, as always, 518-447-7716, and our 211 in our New York State hotline. I also remind people, please, these services are there to help you. One of the unfortunate situations we are in the inner cities of kids not being back to school is teachers being a first responder, mandatory reporter, I should say, not first responder, excuse me, that have to let our departments know if a kid's neglected or abused, and they're trained in that area, and that's kind of hard to catch on Zoom. So please, to the neighbors that are out there, look, we're just asking you to be part of it, and let's take care of our community because, again, that's what I love about Albany County. We're all here for each other. Thank you.